Hello to those who, thank you, David Bent. Hello to those who normally join us. Hello to those who are joining us for the first time. These are our twice weekly briefings on COVID, but we don't just focus on it as a health issue. We focus on the broader societal challenges that are exposed by COVID, and also the many efforts that are being made around the world to work through the response to COVID to actually contribute to a better society. And so today, as is the usual, I'm going to start by giving you my assessment of where things are in terms of the state of the disease and also of the responses to the disease. I'm also going to try to identify some of the larger issues that we're focusing on. I want to give you a very short resume of some evidence that I've just given to the UK House of Commons Foreign Affairs Committee, which I think might be of interest to some of you. I believe that will be important. I also want to talk about my efforts to advance a campaign around the more widespread adoption of comprehensive precautions everywhere, and what interest I'm finding in that. I'm also going to look ahead to the UN General Assembly that comes up shortly and give you some thoughts about that. And as always, I'm going to be looking 6 months ahead because that is my focus. It won't be a huge, long introduction. We're going to be watching it very carefully. I'm sitting here with Catherine Deland next to me, and she will help me to try to keep things under reasonable control. I want to take advantage of the fact that there are several of us on this call who've been on previous calls. I want to use this as an opportunity to advance our discussions. And to help us get started, I'd like to go straight over to Twee, who will give us her introduction. But I can't see you, Twee. You were on my thing just now, but you've disappeared. Yeah, there you are, Twee. I wonder if you could just open us up and give us the opening remarks. Also, if we are going to have an illustrator today, tell us who's illustrating and any other points you'd like to make as introduction. Twee.
Thank you, David. Unfortunately, we don't have an illustrator today. They have hired a lovely young illustrator who actually has a degree in sustainable development. So keep your eyes peeled. She will be joining us in the future. She sounds like a perfect illustrator for our group. So as usual, I'll be launching a polling tool, which will pop up on your computer now. It'll be a window asking you where you're joining from. Once you answer that, you scroll down. Please share your age range. I think I saw Zara earlier, our usual youth representative. And then scroll down further for the third question on how you're feeling today. And so as some of you know, this is how I say that we get to know the mood of the room and who's joining us today, despite being a virtual event. So I'm going to keep that open until later on and share the results with you later. Thank you. Back to you, David.
Thank you very much indeed. I'm just filling mine in. Age range less than 30 years. Very good. And I'm just putting the mood down, which is my usual mood. Thank you very much indeed, Twee. Except perhaps it's noticed that I wasn't telling the truth, so it didn't accept the submit, so I corrected it. Thanks a lot. Good, good, good. Now, before we get going, I just want to give a real shout out to Yusuf Gottlieb. Yusuf put an article into the Times of Israel today. I think it was today, Yusuf. It was titled, COVID-19, It's Up to Us. Yusuf, would you just do the cameo introduction today and just tell us a little bit what was in your article and what the reaction has been from various people who commented on it? Be lovely to hear from you. Yusuf, if you feel like it, just be lovely to hear from you now.
Thank you, David. Actually, the article was inspired by the briefings that you've been giving, and I realized, as I follow the scientific literature, that help in terms of an inoculation a cure is not going to happen tomorrow, and it's a prospect that's in the future. And I realized that in the whole, we have a very strenuous debate here in Israel about the government's handling of the crisis. We had a fairly successful first wave, and now we are on the, in terms of suppressing the first wave, and now we are hitting astronomical numbers in terms of infectious rate, still with a low mortality rate, and we're about to go back into a lockdown at the end of this week. And in the debates about what is appropriate, it occurred to me that really the first line of defense in this, in coping with COVID is our citizens. Because the only strategic instrument that we have at our disposal now in coping with COVID is really basically the very simple, very implementable measures that you, David, have called for and the WHO has called for. And that is appropriate distancing, masking, hygiene, and self-isolation if you are confirmed or suspect that you may have come in contact with an infected person. The key to all of this is that it's really something that you've been hammering at, and with I really thank you for it, is that the best way that we can show social solidarity in these difficult times is by protecting ourselves, because by protecting ourselves, we also protect others. And the key here is social interaction that's carefully, maybe not with great pleasure. I mean, none of us like to be masked, and none of us like to keep distances from those dear to us. But that's what we have to do. So this is really calling for a citizen's approach, that even where we have strenuous debates and government failures and all sorts of distractions, this is the front line. We are the front line. So thank you, David, for allowing me to express that point of view.
Yusuf, I love it. And that was where I really wanted to start. You know, when you do this and you invite somebody to make remarks right at the beginning, you never quite know, but you said exactly what I was hoping you might want to say, which is this message that I'm now saying so starkly and so frequently. John helped me with this, so I give credit to him. The virus is the enemy and people are the solution. And then governments, businesses, and others with the capacity to organize create the conditions in which people can provide the best solutions for the long-term future. I want to keep stressing that the virus is an enemy. Paul Garner, who's been on some of our calls before, said to me, well, David, that's okay, but in my case, I've had to accommodate to the virus. It's been rather horrible, COVID. And I accept that, but I said that actually humanity needs to be able to continue to see this virus as an enemy, to see the disposition that we're going to have in coming years as one of holding the virus at bay, and preventing it from welling up and spiking and coming and causing problems. And then if it does spike, then you get on top of it and you interrupt transmission and you suppress any outbreak and you keep life going. Yusuf, I mean, Israel, a national lockdown, well, that's probably justifiable because it's a super small country, your country. But I really, really hope that countries will be able to avoid national lockdowns by putting in place the two things that matter so much. People being organized to hold the virus at bay, and then basic services, particularly health services, set up to interrupt transmission and to suppress outbreaks with a supportive national government and integrated local action to make it possible. So Scott Knox, I was taking your name in vain just earlier today, talking with our mutual friend, Richard Edelman. And I said to him, Richard, we've got to start shifting towards some kind of campaign that is taken up as widely as possible on the kind of things that Yusuf mentioned that people are going to have to do in responding to this virus. And Richard said to me, in fact, he rang me, we were talking about the unfortunate loss of his wife's mother due to COVID. But in the process, we were talking also about getting wider public awareness of how we can hold this virus back. And I think holding on to these 4 actions, what I call the comprehensive precautions, I probably need a better name, but the 4 actions and really taking them further is such a good idea. I think masking, we need to put number 1, but I think we need to talk about masking properly. We need to be really tough about people not doing this trick, which is putting their masks under their noses. We need to be really clear about what a good mask is like. And so we need to get good masking as something that becomes commonplace. And as more and more countries require masking, particularly for people in confined public locations, so I think putting good masking into the center of our campaigns is important. Secondly is distancing. But we've got to stop this term social distancing and move to physical distancing, because we want social inclusion with physical distancing. That's part 2 of my campaign on comprehensive precautions. Part 3 is hygiene, and it's every aspect of hygiene: hand hygiene, cough hygiene, and surface hygiene. If we do it right, it's great for so many other things besides COVID. It's great for flu, it's great for preventing diarrhea. It's such a good thing to do if we can do it when you don't need lots and lots of water and masses of chemicals. It's just paying attention to the basics on hygiene. And then fourthly, self-isolation when you're sick. And that's led me to start campaigning for people who are asked to isolate because they've either got the disease or think they've got the disease or have been exposed to the disease and are contacts. I want them to isolate without financial penalty. I don't want it to be that you lose masses of money if you isolate, which then inclines you to go to work. I know it's difficult where governments have got very little money and businesses can't afford it and so on. But I just want to stress to all of you that isolation is not just words tripping off your tongue. It's a tough thing. And we've got many friends and relatives around us here in Geneva and in France who are having to isolate. I mean, this virus is quite widespread in this area, and they're isolating either because they might have it or they've got it, and they're doing the right thing around here. They're isolating before they get their test results. If you hang around and wait 2 or 3 days, then you could easily be infecting loads of other people. So best you isolate even before you get your test done, because that's the right way. They're shortening the quarantine around here, and so the period for isolation is reducing, and that's quite sensible. I'm pleased about that. So let's follow Yusuf's advice. Let's try to keep a focus on the campaign. I'm called out Scott because he is connected to quite a lot of creatives, and he and I have talked on and off about this. We also had a discussion with people from who are working with one very large consumer-focused company today, and they were saying there's growing interest in the company in incorporating the campaign language into public communication. So I think I want that. And I'm ready to layer on some of the other things that we've talked about before. Keeping your hospitals open and maintaining services for women, for children, for those who've got cancer, for those who've got blood pressure, for those who have accidents. Maintaining your facilities for people who are suffering from mental unwellness or who've got violence in the home and so on. Keeping your community services going. I want to try to build into my campaigning narrative this whole language about keeping things going and finding the way to organize our lives so that we reduce the risk of COVID, but keep things going. And I don't want anybody to in any way get confused. It doesn't mean that I'm going soft on what I want to see happening. It means that I want to make sure that as we move to the future, we start to really internalize the reality that this virus is here to stay, not going away, and that we need to learn to live with it in a way that holds it at bay, that makes sure that everybody's interests are cared for, and that we can maintain services, particularly services for those people who are really often not getting what they need because of the inequities in our systems. Now, I'm going to ask you over time during this call, just to come in. I don't say, if nothing has changed since you last spoke, don't worry about that. We're not here in some kind of with a set of milestones to move forward. We're a group that meets together regularly, that spares a bit of time once or twice a week to connect. And we're also networking with countless people. We're connected through the LinkedIn group that Loy Rago suggested we set up. A lot of you send text messages to me or emails to me. I've got several from NK SETI who wants to talk about a number of issues with me. And I'm constantly in contact with others of you. So I think we should take advantage of the fact that we're a very vibrant and interactive group, periodically enriched by other people who come in and join us. And so it's okay if we can't see ways to move forward. We express our challenges, but we also need to be expressing our hopes and our opportunities. So just a few things to report from me. The Foreign Affairs Committee in London was really focusing on the international dimension. And building into that, obviously, you start with questions about how the whole COVID-19 started and what went on in those early weeks of really not being sure what was going on at the beginning of January, and could it have been dealt with quicker, and could it have been suppressed quicker, and all that. And so that was part of the questioning. And then there was questioning on what's happened subsequently and where are we now, and what could Britain, what could the UN, what could other institutions do to try to help get on top of this thing with less suffering and misery. And there was a lot of discussion about what are the priorities for the world. And then there was a bit of looking ahead 3 years, looking ahead even longer than that. And will organizations like the World Health Organization still have relevance, and how to make sure it's financed and properly governed? And then what about non-governmental organizations and civil society? What about working between countries? And will there be a new kind of consensus around international health between world leaders? And I think it was really quite good to see that this committee with MPs, UK MPs, was really getting stuck into the international dimension, which many of you have expressed concerns about. Many of you have asked whether or not the shift in the way in which international development assistance in Britain is being governed, and I was pleased to have that opportunity. We were very carefully briefed. I did it together with somebody called Professor Ilona Kickbush. It's on the record, it's not off the record, so me telling you about it is okay. And I'd be interested to know whether you've got any views on that. I wanted to say that there is the UN General Assembly about to come up, and there's absolutely no doubt that there's one big issue on the minds of every world leader, and also of many of the government, of the local governments and civil society groups and businesses and others are interacting. It's the pandemic and how we can get better joint working on the pandemic, but the issue is linked in many leaders' minds to other major existential struggles that we have. Collapse of food systems and increase in hunger. The challenge of what's happening in areas where people are in detention or are fleeing situations, such as we saw tragically in Lesbos, when the refugee camp caught fire, in part as a result of some of the coronavirus restrictions that were introduced there. And then we've got other signs of political disturbance and challenges in humanitarian settings in Syria and Gaza and so on. And then we've got major difficulties in a number of countries with lack of access to equipment, lack of access to testing materials, and a lot of difficulties with trying to make certain that where people are very poor, that the COVID can be dealt with. Overall, the situation is that the UN General Assembly is really focused on the broader aspects of COVID, the broader aspects of inequity. And then there's a lot of real anxiety that as all this is happening, we're also seeing an acceleration of global warming, an overheating of our Earth. We've also got an acceleration of the destruction of nature and of species. So there's a fair number of really big and difficult issues. I'm taking part in a number of events. One is a seminar on interdependence of nations, a universal declaration of interdependence involving the Dalai Lama and other good people on trying to create a spark for a greater attention to interdependence as a way of moving forward. And there's also a number of specific events on environment and nature, on climate, and also on equity, which I'm involved in. I think another set of discussions on nutrition and the growing levels of malnutrition associated with COVID. I think it's good that there is this level now of engagement of world leaders right across the board. And there's a planetary emergency declaration that's going to be given a lot of attention. We're a group led by Johan Rockström, who has been head of the Stockholm Resilience Institute and the Club of Rome. It's right. It's good that these issues are being brought up and are there. Of course, there will be the constant frustration that many of us have that this intergovernmental mechanism is still deadlocked between those interests that want fragmentation and populism and those interests that want coming together and unification and focusing on global issues. But, you know, as somebody who's working in this area and has been doing so for a lot of decades, my judgment is that there is a very high level of popular engagement in these global issues right now. And whilst there's still a major degree of dissent between world leaders, certainly if we go to younger people, it's quite clear they are expecting world leaders to combine together and work on these issues. I'm involved actually on the steering committee of a planning for a food systems summit in 2021. And I can tell you that the deliberations around the future of food, which are so important for nutrition, for livelihoods, for the environment and for climate and for trade, those deliberations have got added urgency across our world because of the way in which COVID has exposed the fragilities and the vulnerabilities of food systems everywhere. I think we should recognize that even though, if we look at the newspapers or listen to our friends and relatives, there is a degree of boredom in some societies about the COVID problem, that those who are focused on global issues and our medium to long-term future are recognizing a huge focusing of attention among decision makers everywhere, and it's increasing quite rapidly. It doesn't mean that we've got unity just around the corner. It doesn't mean that we've overcome the problems that are associated with electioneering going on in the United States right now. But what I'm trying to tell you is there is movement. And that's why I want everybody to stay engaged, to stay involved. I think the next 6 months really are critical 6 months for the future of our world. And I, as always, and I clicked it on the survey, am cautiously optimistic. I'm working with a group of people who are setting up a commission that is looking at the prevention of pandemics of the future, set up by the International Peace Institute. It's rather an exciting outfit. It's called the Compass Commission. And they've been sending me updates and giving me quite a lot of good political analysis. And they take a particular peace and security take on things. They are quite concerned about what's happening in settings where there is humanitarian crisis. And it's quite simply because the numbers of cases and the numbers of people suffering and dying are not coming through in anything like a satisfactory way. So we are still somewhat relying on hearsay rather than precise data. This is important. Those of you who kind of might occasionally browse the papers and you see people saying, well, in Africa, it looks as though the numbers are less. I just want to say, hang on. We just don't have all the data of what's happening. So, it's very, very important. You keep your ear to the ground. You hear what's happening. In Africa, let's say you were Joe Nichols and Zara and Miles in Nairobi and looking at Somalia. You might be forgiven for saying, well, this COVID, it's not the only thing. Look what's happening in East Africa right now. We have locusts. We have floods, terrible floods. We have all sorts of other problems associated with climate and so on. And then we have the constant difficulty of huge inequities in society, possible violence building up here and there. And then you bring along this COVID and it adds to our problems. And so my answer is, if Joe happens to be listening, I quite understand what you're saying. And I don't want to be one of those people who says to everybody, just pick out COVID and make it the only issue you deal with. I'm just saying, could you incorporate COVID into the wider ecosystem of risks that people are coping with? And could you build the resilience in the face of COVID into the resilience that you're working on in dealing with security threats or dealing with climate threats, and just make it part of the broader puzzle of helping communities to be strong in the face of threats? And I see just from a very nice message passed to me by our mutual friend, Catherine Deland, Joe, that you are here and that Miles and Zara are here. So wonderful. And if any of you feel like making a remark or two in a minute, we'd love to bring you in. I'd also like to just give a shout out to one or two other people just to really express gratitude. Carl Taylor wrote a note to me, and Carl, I'm so glad you're on again. We'll come to your points and we'll try to give you an opportunity to speak in a second. I'm really pleased to see Vicky Doyle again. Lovely, Vicky, and I love it if you could just bring us up to date on how Nazim's work to try to advance the narrative, but particularly the narrative about working together in community and being kind, how that is going. Jonathan Fluxman, I'd love it if we could have a discussion with you in a minute on the constant debate about how much of the transmission of this virus is due to nanoparticles being transmitted in the air, what we call airborne, as opposed to microparticles being transmitted through droplets. We'll try to invite you to come in. And if I don't get to you, just unmute and do talk. I'd love it, as always, if Rojan Dahl, if you could possibly come in again and just make a comment, please, Rojan, on what you see as the terrible price that is being paid by the people of Nepal for the impact of containment measures, particularly what happens to poor households who've got no assets. How do they get money in order to be able to eat, in order to be able to pay whatever they've got to pay for? And Rojan, you have been doing a little bit of work in communities in Kathmandu and beyond. And I'd love to get a chance for you to speak, and I'll try to bring you in if I can. So we've got a number of people would like to get to speak. And if others want to speak, please just put a message in the chat. That's how it gets to me. Just in terms of crediting and really thanking people, if you only put your first name on and don't put your surname on, I might not be able to properly place you in my mental network. But I think that Stephanie is the Stephanie who we know so well from Kenya. And Stephanie, if you are, and I think you are, it's great that you're on and you've got an internet that's working okay. And I hope you manage to stay connected. If you fancy talking to us about how things look from your point of view as a young Kenyan scientist, there's a chance, we'd love that. That'd be absolutely great. I'm so pleased that James Ritchie is on again. He's been working so hard on the problem of COVID transmission in food factories and other such things. He's just in the process of releasing some really important guidance, which I think will be significant, and it will be available for unions around the world. That is so important. Lovely to see you, DJ Forza, coming in from your work for the Y. And it was great that you joined us last time and told us what you were doing. I thought I saw on my thing, I've just got a little thing here, Chris Lara is on from Duke University and doing such important work, particularly focusing on Black Lives Matter and some of the other issues associated with that, and looking and giving us a take on US politics. Marianne, thank you for being on. I know that we've got a lot of work to do in relation to the Commonwealth Medical Association, and I was very glad to be working on the video that you gave us the other day. Super fun to do that. So let's now go to Twee before we come to call on people. Twee, if you wanted to just tell us a little bit what's come through from the survey and any other comments. And by the way, if I haven't mentioned your name, you know what it's like. You've got this lot of people and there are many, many friends who are on who I would just like to say thank you for being here. Twee, you have the floor.
Thank you. So you'll see I've shared the results with you all to see who's joining today. Always good to see at this time of the day people joining from North America. We've got, and Latin America, we've got 10 people there, and a nice spread with most coming from Europe as usual. In age range, great to see the very even spread across all the ranges. 6 under 30, I think we have to say 5 because David, you selected that, didn't you? And then for number 3 on emotion, how we're feeling today. It's interesting, it's great to see that no one's feeling too down, sort of more in the negative realm there. And then we always seem to be highest on optimism. We've only, out of the 11 briefings we've had so far in series 2, we've only had 1 where we jumped up to enthusiasm. So in general, we do stay around. While it's still very positive, it's interesting to note that we're often not much higher. So that's that for the poll, and back to you, David, for interventions. Thank you.
You know that my life is spent living in paradox. I am optimistic and pessimistic at the same time. I'm hopeful and despairing at the same time. I'm seeing good and bad in different initiatives at the same time. And I navigate that, and it feels quite weird sometimes. And I suppose if I was truthful, I would say I'm optimistic, but I think I'm also pessimistic. There's going to be a lot of eggs broken to make the omelette of the future. And so I quite understand that some of you might find it hard to fill in your tick boxes on the survey. We'll come back again at the end to Twee if all goes according to plan. The other members of the team who are on, obviously Catherine's on, thank you. John is on somewhere. I saw you just now. Thank you. Great to see you there, John. And Saber is on. Lovely that you're here. And welcome back from your break in Tunisia. Members of the team who are on, do feel free to jump in. Don't hold back, especially if you've got something to say. I want to go first to Marianne Hazelgrave. Marianne quite correctly said that I did make a mistake when I was talking about the UN General Assembly. I should have said that one of the major areas of focus of the UN General Assembly that the Secretary General is really keen on is what's called the 2030 Agenda for Sustainable Development, the plan for the future of the world and her people that was agreed in 2015, the most wonderful document with 17 goals and 169 targets built around 5 amazing principles. Yeah, they're going to be discussing that, Marianne. And Amina Mohammed was saying that there's going to be a major event on the Sustainable Development Agenda. And that's because of real worries all over the place that progress on this important plan has been knocked back by COVID. And I heard Mr. Gates saying, and I think you picked up on it as well, that it's 2 decades lost as a result of coronavirus. I think at least. I think we're still, still working our way in. But I also think that we are seeing some of the problems associated with COVID, and we're given a chance to work on them. And that's why I mentioned the Food Summit, because really that does give us a chance to work on the challenges of food in the coming few years. Your question that Marianne was, I think, posing was, are the Sustainable Development Goals and the Sustainable Development Agenda still valid? Or is some kind of different approach needed? Marianne, would you like to come in briefly and give us your point of view on that?
Very briefly, because I think you've answered a lot of it, but the point is that we seem to be being knocked off course, and the focus has been on the SDGs since 2015. We've got 10 years. And if we've moved back 20 years, I know my arithmetic isn't good, but we're back before we were where we started. And it seems that all the things we were talking about, you've just talked, David, about nutrition, goal 2, but the interlinkages and what was special about the SDGs and the 2030 agenda seems to be sidetracked in a way, and it does worry me. And it worried me what Bill Gates said when I heard it, because we've gone back in so many areas, for example, that affect women and so on. So that's why I picked up on what you didn't say, because we have to keep, if you like, banging on about the SDGs, the 2030 agenda, and the General Assembly has to come up with a way of making sure that when they're talking about COVID, they're looking still at what we should be moving forward on, and keeping that focus. Thank you.
Yeah, well, thank you very much indeed. And those of you who've got a chance might like to look at a report by an outfit called the Global Preparedness Monitoring Board, GPMB for short. Catherine will kindly put the URL into the chat line. This is a group that was set up by Mr. Guterres really in 2017 to keep an eye on what was going on in the way of pandemics. They produced a report before COVID titled "The World at Risk" that said in a stark way, wake up, world leaders, a pandemic is coming and you are forgetting about preparedness. They produced a report that they released yesterday titled "A World in Disorder," which actually said the pandemic is here and the way in which the world is dealing with it is chaotic. And yes, the Sustainable Development Agenda is being, unfortunately, pushed back, and the inequity dimensions and the gender dimensions of this pandemic are absolutely awful. You know, you can't say that we haven't been told. My challenge right now is we've got a lot of warnings coming out about what's going wrong. How on earth can we get world leaders and decision makers to take note of this and act on it? I see Yusuf was actually saying there's a name being given to this moment in time. And I actually am very glad, Marianne, that you brought out this issue of the kind of leadership failure, meaning that we really have to look super hard at what our compass is and what we're trying to aim at right now. So do have a look, if you don't mind, at how Grohol and Brundtland and ASC that took account of that. I just say if Henk Bekkerdam is on, Henk, don't just be ready to come in and give your quick comments on what you feel as particularly if you did look at the global pandemic, GPMB report. I'd be interested to know your take on it. Let me go to Jonathan Fluxman, who comes with a quite technical point, but I want to build on it. Jonathan, if I ask you to unmute and just make a point now, that would be really great. Jonathan, tell us where you are.
Hello, David, and everybody. I'm a retired GP. I live in London. I hail from South Africa originally. I just want to say how wonderful it is that you're holding these briefings and people like yourself making yourself available to the general public, and how lovely it is to see people from all over the world. This is fantastic. So many meetings are usually of the privileged global north, and I see here we have people from all over the world, so that's great. So very briefly, I'm sure some of you will be familiar with this debate about the transmission routes of COVID-19. I've been looking into it in a great deal of detail, and I've written a couple of articles on it. But to my mind, I think it's very important that we think about the aerosol or airborne route of COVID. It seems increasingly clear to me that this is becoming a significant, or the evidence that it is a significant route of transmission is becoming increasingly clear. I know aerosol scientists have been talking about it for some time, and I think it's beginning to break through now into the medical community and so on. And I know that the WHO and CDC, and here in England and Britain, our Public Health England, have been rather reluctant to embrace this. But I think the dangers of indoor spread are appreciable. We know that almost all outbreaks, and certainly the super spreading events, seem to be happening indoors. And to my mind, I think there's something to be said for adding the need for proper ventilation to the basic health education message. I think this is crucial as we are all being encouraged to go back to work, and school and so on, which are all indoors. Here in Europe and in the global north, it's becoming autumn and winter. We're going to go back indoors a great deal more, and I think that poses some real risks. So I'd be really glad to hear your views, David, and perhaps some of the other people as well. Thank you so much.
Jonathan, it's lovely that you're here. And now I realize who's been writing these articles that I've been looking at and quoting off. Yeah, I mean, this thing can be transmitted through droplets. It can be transmitted through nanoparticles, tiny, tiny, tiny particles that can be carried in the air. It can be transmitted off surfaces. And the key question is, how important are the different modes of transmission in different circumstances? I'm absolutely certain that in ships, particularly where the ventilation is a little bit clumsy, that can actually be a place where there is airborne transmission. And we have evidence, as you know, from Diamond Princess and other conveyances that the thing can be airborne in ships. We have suggestions in some cold factories that it's been airborne, particularly in James Ritchie told me, and he's on the call, that in at least one outbreak that was looked at in Germany, it was definitely airborne. We've got some stuff coming from choirs, and Jonathan, you will have several others. The question that I'm struggling with, Jonathan, is just how important is airborne transmission of these tiny, tiny particles versus the droplet transmission of the larger particles, and what does that mean? You've said ventilation should be given greater attention, but the other issue that we will need, I think, to take on board if airborne transmission gets more and more certain is we're going to have to say to people, these plexiglass dividers and the shields that sometimes people wear as opposed to masks may not be that much use against airborne infection. So could you just give us a few seconds, Jonathan, on, besides adding in ventilation, what are the other aspects of guidance that might need to be changed if we conclude that airborne is a major means of transmission as opposed to a less frequent one?
Thank you very much, David. I agree. The proportion of each route is very difficult to ascertain, and you may know that in lots of the studies of these outbreaks, the authors always say it's impossible to say to what proportion the three principal routes operate.
Yeah.
In terms of the guidance, I think we need to take away this false dichotomy. For example, the new guidance that's just come out here in Britain, that as long as you are 2 meters away, you're distancing 2 meters away, it's not really necessary to wear a mask or to bother too much about ventilation.
Yeah.
I think, most people looking at that will say, but hold on, if we accept that there is airborne spread, biology and science doesn't work like that. It's not suddenly a wall at 2 meters that comes down and nothing passes beyond that distance. So I would like to see the guidance say, in all indoor spaces, particularly where the ventilation is poor, wear a mask. If you're in the same indoor space as other people, I think a mask should really be worn at all times, irrespective if you're 1.5 or 2.5 or indeed 4 meters away. And we've seen from studies that the viruses travel through the air up to 8 meters. There was that study, which I think you alluded to, in Germany, in the meatpacking plant. The workers were more than 8 meters away, got infected. So I think more detail about the guidance to take into account this is very, very important. And more detail than simply saying, open the window and open the door when you can. The Americans in particular have got quite far in terms of looking at proxy measures for adequate ventilation, in terms of using CO2 monitors, and also assessing ventilation requirements in terms of air changes per hour. It is a bit technical, but it's really not rocket science. And I think anybody who has some common sense and who can call on some air conditioning engineers and things like that for help will be able to calculate and work out, is this a safe space, or do we need to add things like better ventilation and indeed air cleaning devices like portable air cleaners. Thank you so much.
We'll hold this. Catherine and I are working on this in real time. James Rich has gone off the call, but we're working a lot with him. Catherine, could you open your camera, talk into my microphone so we don't get feedback, and just give us, if you don't mind, in about a minute or so, your current status, understanding of the status. And everything we say is ad referendum to WHO. We're super cautious not to be second guessing our friends just across the road.
So to the best of our understanding, and this is, again, to be very technical, the difference between droplets and aerosolization. Droplets are slightly larger and so don't stay in the air for as long. Aerosolization is droplets that are very, very small, or tiny particles that are small, and so they stay in the air for longer. There's no, right now, good evidence that human-driven coughing causes aerosolization of COVID. There is evidence to show that there's some mechanical processes that can aerosolarize, not a great word, but aerosolarize the virus. And that includes things like polishing your teeth and using potentially the kinds of machines they're using in meat processing if there has been COVID put onto one of the surfaces. That isn't to say that the data isn't being looked at very carefully for human aerosolization. It just isn't what we're seeing yet. So I think that's where things stand.
Anyway, Jonathan's point, and I think I take it totally, is retain humility. Don't say it's not happening. And linked to retain humility, entertain the possibility. And certainly my line, having talked to friends and colleagues who are convinced that they got airborne COVID, my line is keep wearing those masks and wear them properly. And I've become rather fastidious about that and will continue to do so. Jonathan, thank you. I hope you can stay involved, and don't hesitate to send us the odd email, or if you can't get us through email, contact us through LinkedIn or whatever, so that we can keep connected. It's lovely what you're doing. Thank you for your writing. Going to making quite a shift now. Vicky Doyle and team have been doing this amazing work with Nazim on trying to turn COVID messages into song. And I just wonder, Vicky, for you to just do a quick assessment of where things stand and how it feels, and whether or not Nazim is still feeling turned on by doing this, or is finding that it's quite tough. Are the messages getting uptake, particularly in Africa, but also other parts of the world, etc. Over to you.
Okay, thanks very much, David. Just for those of you who haven't heard his music yet, what he's trying to do is use, through his music, build resilience and hope, and remind us all that we're not alone in this, that we're in this together. And his latest song is called Be Kind. And that was very much, I think, partly inspired by some of the discussions we've had on these online briefings, where we've discussed how COVID-19 really magnifies inequality and vulnerability. And I think particularly when we're looking at those alarming reports of gender violence and increases in teenage pregnancies, that's really why this song came about. And I think for Nazim, he felt it was important as an African man to be singing this song about being kind to the womankind. And David, in response to your question, he's still very turned on by this. In fact, he's in the recording studio at the moment, recording a song for the United Nations General Assembly, actually. He's going to be singing a song at the Accountability Breakfast, which will be obviously all about a time for change and about getting governments accountable and people more responsible. So very excited about that. And I was just wondering also for the campaign, whether you want any help and perhaps us help him write a song for that. So maybe we can discuss that later. Please.
Well, Twee has lit up her video and is smiling with absolute
Good.
eye. And so that's great. Just say that I'm not looking at the chat all the time because I'm trying to keep my eye on the camera. But I saw a couple of comments coming in. Nazim's music has a fair number of fans here, including Rebecca and Sarah. And I think if you can get the message back that, yeah, we're probably in a different age group from those he would like to sing for, but we love them.
I will let him know.
Thank you very much. I'd like to just, I wanted to come to a couple of other people now. To NK Sethi first, and then Rajan next. So Rajan, if you could be ready. But NK, very, very quickly, I mean, you're in India right now, and the Indian situation is causing quite a lot of anxiety to government. There are some tough issues, and you're quite interested in comparing across between countries in South Asia. Give us your take on where things stand from where you are, please.
Thank you, Dr. David. Yes, certainly things in India are a cause of concern. And I think about 2 or 3 days back, the Prime Minister's office also held a very high-level meeting to review the situation. And there is also thinking that we need to look into what is going around in the region. And it emerges that Bangladesh, which is doing maybe relatively better at this stage, has adopted some strategy. And Pakistan, as per the news, has adopted a strategy of smart lockdown. Now, the thinking is emerging, how do we go about now in terms of area-specific expansion for opening, or area-specific putting some restrictions so that the caseload or the rate of increase doesn't go up and up. So for that matter, I have done some look into what is going on. And as per my information, Pakistan adopted a strategy of smart lockdown, whereby they identified 500 coronavirus hotspots.
Yeah.
And I can go on, but then regarding Bangladesh, resurgent Bangladesh adopted a multi-pronged approach where they are opening up to the extent feasible while monitoring the risk of the outbreak.
Yeah.
And then they are extending lockdown or a stricter, wider movement of restriction of people in areas where there is a high case load, or maybe there is a high risk of transmission, or the densities are higher. So maybe we'll have to rethink about what has been going on. And in case there is some guidance from a global body or people like you, that will be really helpful. Otherwise, I'm in a process of preparing some short note for that purpose. Thank you.
Okay, well, I just want to say very clearly, the multi-pronged approach, we're trying to make it as locally specific as possible, is where we are really encouraging people to go if they possibly can. We really are discouraging nationwide lockdowns because they have such terrible implications for poor people. But if there's not enough testing to tell you where the virus is, it gets very difficult to go down to a more local approach. Henk, Bekkerdam, you know, you're out of India and you're back in the Netherlands. What would you like, as you come back to Europe, have you developed any feelings as to what you would be advising, not just for your country where you used to be working, but for other countries, poor countries where they're struggling a bit with strategy?
Thank you, David. And I also just was able to print out the GPMB, A World in Disorder. And some of these lessons are already there. But I still feel if I read this one, it's still, there are a few things which I'm also missing in even this global appeal. And they have marvelous people and it's an excellent report. And it reflects also very much from the last time I was able to join. We are still learning. We still need to understand things. But Jonathan was just saying is absolutely also right. We are still learning about the things. And this needs to be done in a national coordinated manner, and it needs to be internationally also pulled together. Because we're in it for quite some time. I really feel that that research component of dealing with a new disease, a new challenge, I think that that needs to be further strengthened. And I think that's also most likely part of that report, and I hope that one also comes out. Then this whole issue, which I can see also in the report, and what you're also alluding to, prevention is the best. We have this virus which can spread while nobody even is aware of it, that you are spreading it. And I think that's the part what you also said from, in order for us to have a fighting challenge, the testing, the contact tracing, the isolation of patients and the quarantine of patients, and then follow up again. That will be one of our major weapons. And that's also one weapon which I hope that in India can be used. Yeah. The polio, if I look at the polio, what we did over there, then the surveillance system will be key. Now the numbers are now absolutely overwhelming. And unfortunately in India, while they were able to postpone what was happening through taking it very seriously from the onset, but with the lockdown, also the economic consequences for the migrants were enormous. And what we've seen with H1N1 in India, when it started the first year, it was not in every state, and definitely not at the same level. And unfortunately, with the lockdown, when migrants came back from places where there was indeed COVID, they went then to places where there was not yet a COVID. So India is an enormous challenge. But having said so, I still think that the more we can also deal with these things in a united way, coordinated way at national level and global level, that will still be very important for the months and years to come.
Totally agree. Thank you, Henk. Could I just go to Rojan? Rojan, if you are connected still, you were telling me that the challenges in Nepal associated with the virus coming back to, you were basically saying that the virus has come into Nepal from workers who returned from being on projects in India. You're saying it's really tough in Nepal, and the poor people are being really badly affected. Could you just give us, if you don't mind, super quickly, just a quick insight as to what's happening?
Thank you, David. Most of the cases in Nepal are coming through the migrant worker who goes to India for the informal sector work, as we have already discussed. So these peoples, in the absence of jobs, so they are returning back to Nepal and they are carrying the virus too. But what I visualize is that, as we have seen in the earthquake, what happened is that the trafficking of women and children rose after the earthquake. So what I'm seeing right now is that similar trends is going to follow in Nepal, because trafficking of women and children is going to one of the biggest challenge after the post-pandemic. Because they have lost their means of livelihood. The parents who have lost their means of livelihood, they are facing hunger and starvations, and they are more likely to be exploited and being trafficked.
Yeah.
So similar kinds of trends is seen similar to the earthquake. So we need to have a greater means advocacy on that, safety nets for the women and children, protecting these women and children.
Yeah.
So many multidimensional consequences of COVID are.
They're everywhere, Rojan, everywhere. Thank you very much for bringing this up. You know, I smile to everybody, but, you know, we're hearing really awful news. And the thing is that in Nepal, there are some pretty good systems for monitoring issues like human trafficking. And if they're sounding the alarm, and I'm not surprised about this, then we need to take it super seriously. The fact is that there are hundreds of thousands of Nepalese people who are absolutely without income as a result of COVID and the containment measures. It's not just in Nepal, it's in other places, rural India, Bangladesh. This is just a terrible situation, and people are unfortunately having to give away their children in return for money. This is a known practice that people do when they're short of cash, but it's on the increase. Thank you, Rojan. And you know, I wish I had solutions to some of the problems you described, because you described them to me with incredible detail and understanding, whether it is the plight of the porters who are not getting loads to carry on their backs and therefore cannot get the money because the tourism has broken down, or the people who have got nowhere to sell their produce, whether it is fresh produce or handicrafts. It's a really desperate situation in Nepal. Everybody, I've gone on too long. I do want to give just a couple of seconds to John and on your own if you want, or you can bring in somebody else, just to talk about the fact that we are having to live and plan in an environment of uncertainty. And we're having to learn to be leaders in a context of uncertainty. We don't know where this is going, but we've got to be able to step up and actually take the leadership challenge, because nobody else is going to do it. And John, could you give us any thoughts you've got on that? Over to you.
Well, things are uncertain, and yet there are things that we do know that work. And it was something that came out earlier in this call about, and I think it was Yosef maybe at the start, saying it's about more of us doing more of the right things more of the time. So how do we encourage people to do that? How do we take responsibility for doing that ourselves? We know what those things are, about mask wearing, about physical distancing, about being in enclosed spaces and taking care and paying attention in those circumstances. And that's the key to it, really, is think of it in terms of what is it that each of us can do. How do we influence those around us, those we come into connection with? Think always about the relationships that we hold, and how do we spread the right messages in it, such that more of us do more of the right things more of the time.
John, thank you. And thank you also to Holly Wheeler, who is working with John in NHS Leadership Centre. Thank you to that particular group. Chris is also on from Thinking the Unthinkable. We must keep a parallel line of thought and action going on the leadership skills we need to develop and we need to share with younger people to deal with this and related challenges. As Rojan said, everything is linked together, and you have to take a systems perspective in dealing with it. I'd like to say that Kath Deland has put the link to the latest from the World Health Organization on aerosolization in the chat. Just to say, Jonathan, we are super connected with that particular group, who occasionally get a bit of a hammering from certain activists for saying, we're told that they are not getting it right. But I think that group are super aware that there is a growing body of evidence about aerosolization. And I think your point about being much clearer on mask wearing is something that we must take seriously and will promote as widely as possible. Now, I'd like to also acknowledge that David Bent is on the call. He's a great friend of ours and is doing fantastic work on a commission that he's doing on the future. David, would you like, you're going to get the last word, just to make your remark that you were going to make before we close and with Twee this down.
Thanks, David. Just in the chat, I put a link to a Twitter thread pulled together by a friend of mine, Alex Evans, who people may know used to work for the Secretary General a few years ago. He now has a project called the Collective Psychology Project about how we can address our inner trauma in order to then work with each other better. He was doing this for years before COVID. Of course, COVID has given him a chance to dive deeper, and with Wellcome Trust funding, they've looked into mental health and COVID. And what they found is that, although of course it's had lots of effects, people are finding ways of coping and thriving. And so I recommend the report and the Twitter thread to everybody by way of introduction. And that one of the key points is, and I guess this is one of your messages too, David, we can find ways of creating our own sense of agency, even in these tough times. And with that comes the ability to be resilient for mental health. So with that,
good.
And that was all I was going to say.
And I just really applaud and thank you for that. Tough times give us an opportunity to find new depths that we didn't realize we had. And I think everybody on this call is finding new strength. We find new strength inside ourselves. We find new strength by connecting. We find new strength by knowing that there are others in the world who care about us. David, you are a real part of that family. Twee, last words from you, please, if you're still on.
Yes, let's keep connecting, whether it's in this call, which we'll have again at 8:30 a.m. Friday Central European time, or same time next Tuesday, but also in our private COVID Ready community chat group on LinkedIn. Just send me a message and I'll add you to that group. Thank you.
So to everybody, just going from the top, Zara, Yusuf, Ruti, Karen, Jonathan, Loy, NK, Carlos, Veronica, Georgina, David, Sarah, Hank, Marianne, Vicky, Louisa, DJ Forza, Christoph Duke, Rojan, Carl Taylor, Chris Lara, Chris of Thinking the Unthinkable, Holly, and others. You can't get all the names, plus members of the team. We love these moments. They give us strength. And to Zara, we will do one specially for you. You just tell us when you want it and how you want it, and bring your friends along round the Zoom, and Zara, it'll be your show and we'll have you running it. And that's a promise if you can fix it up. Bye-bye, everybody. Thank you.
Bye.
Thank you.
Zara, it's a special moment for you. Shout out for Zara. I hope it's all right there in Nairobi. Best wishes to your family as always, and to your friends. Bye.
Bye. Thank you.